In human life, we form many connections. These connections can be parent-to-child connections, they could be sibling-to-sibling connections, they could be best friend-to-best friend connections. Regardless of whatever they are, they're part of what makes us human. However, tragically, the loss or the death of a close one is also equally as ubiquitous to the human experience, right? And we all have different ways of dealing with this sort of loss, and there's generally healthy ways to deal with that. Among these include ritual mourning, notable upheaval of social life, acute sadness, loneliness. These things can be present for a little bit amount of time, not too long. And these are healthy grieving patterns, which can generally last a few days, a few weeks, even up to a month, but they're not persistent and prolonged. However one deals with close loss can be maladaptive. It can be harmful grief, right? Harmful grief. Now, the DSM has a sort of entry for this sort of harmful grief in a psychological standpoint. This is called prolonged grief disorder. Now, prolonged grief disorder has specific diagnostic criteria. The person who is experiencing prolonged grief disorder has to have lost the close person within a year. This person has to be close, of course. They have to have persistent thoughts about this person, and they have to have an intense longing for this person, right? So yeah, they're longing for them, they're thinking about them pretty persistently. Furthermore, they have to have at least of these frequently and clinically significant symptoms. They have to have a sort of, they could have like a disbelief about the death. So they're sort of selectively not believing that it happened. They could have an intense emotional pain. They could have trouble reintegrating into society here. Let's see, so reintegration, it's kind of hard, you're sort of hitting a reintegrative wall with the way that things normally are with you. They can feel intense loneliness. All of these are emotions that a person with prolonged grief disorder can experience as a result of the death. And generally speaking, these exceed cultural expectations. However, what's really important about these cultural expectations is cultural identities. And one cultural identity that I want to focus on within prolonged grief disorder is the masculine or male gender identity. What I'm curious about is how much does the male identity influence prolonged grief disorder, right? Concerning rates, a 2021 survey found that roughly 3%, so here let's draw a circle, roughly 3% of people who are recently bereaved have been shown to demonstrate symptoms of prolonged grief disorder, right? Only about 3%, right? And an even smaller portion of these people are men. Only about a quarter of the people who are exhibiting symptoms that can be diagnostically accepted as prolonged grief disorder were men, right? So that's the first thing to note within the masculine experience. But secondly, not only are men a smaller proportion of these people experiencing these symptoms, but also our perceptions from the outside of symptoms of prolonged grief disorder can be different depending on whether they're a male. So one thing that immediately comes to mind is the emotional numbness, loneliness, and difficulty reintegrating into society that I mentioned earlier, right? So these things, feeling numb, emotionally numb, feeling lonely, all these things, right, which are generally accepted symptoms of prolonged grief disorder, might be understood by outsiders as being strong, right? Strong, independent man who is supposedly doing a great job of dealing with a loss, right? This is especially true for the masculine ideal in white American society, right? We're supposed to be strong, independent, emotionally impenetrable, and this sort of framework that we live in may mistakenly perceive these qualities as virtuous, right, when they're really symptoms of a disorder. Furthermore, the presence of prolonged grief disorder symptoms has been found to vary with gender. A 2020 study found that over time, here, let's make a graph. Over time, we'll have the number of symptoms, right? We'll have time passing right here. I can't even write time. Over time, it's been shown that men's prolonged grief symptoms over a year have started at about 9 at a 2-month period right here. And then they decrease to roughly 7, right? Women were the inverse. They started roughly at 7 and they raised at roughly about 8 at the end of an 11th month study, right? So here's, this one's men, this one's women, right? So we can see that it peaks at different times, and though it's hard to be certain about such a new diagnosis in the DSM, we could speculate that the effects of prolonged grief disorder, which can include a substance addiction, intense withdrawal, suicidality, those things, they might be more intense for men in the beginning and then decrease over time, whereas for women, the inverse would be true. Clinicians, of course, must be aware of the gender differences of prolonged grief disorder when they're doing treatment, right? There are a couple of accepted ways to treat prolonged grief disorder. There is cognitive behavioral therapy, CBT, and there is complex grief therapy, right? These two things are accepted for dealing with prolonged grief disorder, for treating it, right? But those who are using cognitive behavioral therapy, they need to take into account how men, because of their perceptions of masculinity, might not have the vocabulary to express their grief, right? So when you're having a therapy session or a communicative session with your client, right, because they don't want to be perceived as weak, they might not know how to talk about it. They're so used to not talking about it at all. And similarly with complex grief therapy, those clinicians need to remember how men, they might be, conditioned into burying their pain into their subconscious, right? And they might not be aware of their own denial, because complicated grief therapy, here I'll scribble that out, complicated grief therapy focuses on denial and restoration, right? Those are two key components of helping the person recover. And if the client does not know about their denial because of the masculine forces that they're so accustomed to, then that can be a problem. Now, in short, prolonged grief disorder is a new addition to the DSM, and it's not without its controversies, right? Is it specific enough like this? Is it not specific in this? How can we make it better? And nevertheless, regardless of the editing that we need to do, clinicians need to account, for the masculine experience and the gender norms and expressions that men experience when they're in the diagnostic process, right? This is especially important for men, right? Because the stress symptoms, as I've said, can exhibit themselves differently. And the clinicians, of course, need to be well-versed in the male experience so they can help treat their clients and help them recover through prolonged grief disorder.